Workers' rights. The Occupational Safety and Health Administration, OSHA, is a federal agency that guarantees rights to a safe workplace. Under OSHA's rules, workers who might be exposed to contaminated blood or body fluids have specific rights. Employers must train workers who might be exposed to blood or body fluids about the hazards and how to protect themselves. This training must occur during working hours at orientation at no cost to the employee, and annually thereafter. Standard precautions must be practiced at all times. Puncture-proof and leak-proof containers must be provided for disposal of sharp items. There must be a system for reporting exposures to blood or body fluids. Employers must provide free hepatitis B vaccine, free protective equipment and free immediate medical evaluation and follow-up for anyone exposed to blood or body fluids. Employees must receive confidential treatment, and their medical records must be protected. Workers' responsibilities. Always use standard precautions. Actively participate in evaluating safer equipment and encouraging your organization to purchase safer equipment. Be open to new products or practices that could prevent exposure and protect workers and clients. Be immunized against hepatitis B, getting the series of 3 injections. Report all exposures immediately after cleaning and disinfecting the exposed skin or mucous membranes. Comply with post-exposure recommendations of your organization. Support other workers who have been exposed. HIV-infected workers who continue working deserve support and confidentiality. Know your own HIV, HBV, HCV status. If you are positive for any of these viruses, you do not pose a risk for clients if you don't do invasive procedures. Human immunodeficiency virus, HIV, is the virus that causes AIDS. Risk of infection after exposure. Needle stick is the most common cause of work-related infection. Risk factors include the amount of blood or fluid, the puncture depth, and the disease stage of the infected person. The average risk of HIV infection after a needle stick or cut exposure is 1 in 300. The risk after exposure of the eye, nose, skin, or mouth to positive blood is less than 1 in 1,000. If the skin is damaged, the risk may be higher. Treatment after exposure. There is no vaccine against HIV. Post-exposure treatment is not always recommended. A physician or exposure expert should advise you. Drugs used to prevent infection may have serious side effects. Perform HIV antibody testing for at least 6 months after exposure. 99.7% of needle stick cut exposures do not result in HIV infection. Hepatitis B virus, HBV. Risk of infection after exposure. Hepatitis B vaccine prevents this disease. Persons who have received the vaccine and developed immunity are at virtually no risk for infection. A series of 3 injections are required, given initially, then 1 to 2 months later, then 4 to 6 months after the first injection. Workers should be tested 1 to 2 months after the vaccination series to make sure the vaccination has provided immunity. For the unvaccinated person, the risk from a single needle stick or cut exposure ranges from 6% to 30%, depending on the level of virus in the infected person's blood. A higher concentration of virus makes it more likely that someone exposed to that blood will become infected. Treatment after exposure. Everyone with a chance of exposure to blood or body fluids should receive hepatitis B vaccine, preferably during training, unless it is contraindicated because of allergies, pregnancy, or potential pregnancy. Hepatitis B immune globulin, HBIG, effectively prevents HBV infection after exposure. Recommendations for post-exposure management of HBV may include HBIG and/or hepatitis B vaccine. The decision to begin treatment is based on several factors, such as whether the source person is positive for hepatitis B, whether the worker has been vaccinated, whether the vaccine provided immunity. Hepatitis C virus, HCV. Infection with HCV carries a great potential for chronic liver disease and can lead to liver failure, liver transplants, and liver cancer. Risk of infection after exposure. Hepatitis C virus, HCV, is a growing problem. The risk for infection after a needle stick or cut exposure to HCV-infected blood is 1.8%. The risk after a blood splash is unknown but is believed to be very small. However, HCV infection from such an exposure has been reported. Treatment after exposure. There is no vaccine against hepatitis C and no treatment after an exposure that will prevent infection. Immune globulin, HBIG, is not recommended. Following recommended infection control practices is vital. There are several tests that should be performed in the weeks after an exposure and for 4 to 6 months afterward. Confer with a physician or an exposure specialist. Additional precautions for infection control. If you know or suspect that a client has a disease that is spread in one of the following ways, use these extra precautions, in addition to standard precautions. Airborne germs can travel long distances through the air and are breathed in by people. Examples of diseases caused by airborne germs: TB, chickenpox, shingles. Wear a mask. If the client has, or might have, tuberculosis, wear a special respiratory mask. Ask your supervisor. A regular mask will not protect you. Remind the client to cover nose and mouth when coughing or sneezing. Treat the client's used tissues or handkerchiefs as infected material. Contact germs can cause the spread of disease by touch. Examples of diseases caused by contact germs: pink eye, scabies, wound infections, MRSA. Wear gloves. Treat bed linens, clothes, and wound dressings as infected material. Wear a gown if the client has drainage, has diarrhea, or is incontinent. Use a disinfectant to clean stethoscopes, blood pressure cuffs, or other equipment. Droplet germs can travel short distances through the air, usually not more than 3 feet. Sneezing, coughing, and talking can spread these germs. Examples of diseases caused by droplet germs: flu, pneumonia. Wear a mask when working close to the client, within 3 feet.